Good morning, esteemed colleagues, and thank you to Professor Sakina Hajabrahimi for the opportunity to participate in the JBI Collaboration European Symposium. I'm delighted to share with you today a brief overview of JBI and the JBI Collaboration and the ways in which our global collaborative evidence network promotes and supports evidence-based healthcare across Europe and the globe. My name is Bianca Pilla. I am the Director of Global Relations at JBI and the Chair of the World Evidence-Based Healthcare Day Steering Committee. So a brief outline of my presentation today. I'm going to provide an introduction to JBI and JBI's approach to evidence-based healthcare, the role of collaborative evidence networks in the global evidence ecosystem, an introduction to the JBI collaboration, including its purpose, form, and functions, and highlight some of the activities across the JBI European region and the impact of the work that JBI collaborating entities undertake in promoting and supporting evidence-based healthcare globally. Now, for those of you that are perhaps unfamiliar with JBI, we are a global organisation promoting and supporting evidence-based decisions that improve health and health service delivery. Our vision is to provide better evidence to achieve better outcomes and a brighter future for communities globally. JBI offers a unique range of solutions to access, appraise, and apply the best available evidence. But of course, we can't do that alone from Adelaide, Australia. So international collaboration is critical not only to us, but to the broader evidence-based healthcare endeavour. JBI works with universities, hospitals, NGOs, and research and policy centres from across the globe through the JBI collaboration. In doing so, we ensure that the research evidence that we seek to synthesise, transfer, and implement is culturally inclusive and relevant across the diversity of healthcare internationally. So many of you will be familiar with this. The JBI model of evidence-based healthcare was developed in 2005 and updated in 2016. The inner wedges outline JBI's conceptualisation of the steps involved in the process of achieving an evidence-based approach to clinical decision-making. The outer wedges operationalise these steps and articulate how they might be actioned in a pragmatic way. All of the activities that are conducted by our JBIC partners worldwide are informed by this model of evidence-based healthcare. Ultimately, we believe that the success of the global EBHC agenda depends on individuals and organisations working together within a functioning evidence ecosystem. JBI understands that the challenges in building an evidence base and capacity to implement evidence are diverse and vary between countries, regions, cultures, and that differences in economics, clinical expertise, health policy, and health systems often require strategies and solutions that are unique and specific to their local context. This is where networks come in. Collaborative evidence networks are at the heart of evidence-informed decision-making by bringing together diverse actors from within an evidence ecosystem to share information, expertise, and build capacity for knowledge generation, transfer, and use. The last 30 years has seen a profound transformation in the role and functions played by collaborative evidence networks within the global and local evidence ecosystems. Networks like JBI, Cochrane, Campbell, and many others pictured here and beyond, while we differ in form and function, we were all established with a common goal, and that is to work together to produce, synthesize, and disseminate evidence to inform policy and practice to improve lives. So how does JBIC achieve this? Well, the JBI collaboration achieves this in numerous and, truth be told, complex number of ways. However, today I will focus on just a few examples with a spotlight on the JBIC European region. But first, some background. The JBIC was founded alongside JBI in 1996 and for the last 27 years has contributed to driving the global EBHC movement forward. It has helped to establish JBI as a multidisciplinary global leader in this space. Today, JBI partners with 86 centres of excellence and affiliated groups in more than 40 countries. JBIC entities are self-governing but coordinated through JBI in Adelaide, Australia, and are supported by 5 strong regional groups that foster regional collaborative projects and mentorship and support of novice groups. This includes the JBI European region meeting today, comprising of 20 JBI Centres of Excellence and affiliated groups in 17 countries as pictured in this map here. The JBI Collaboration is the largest global evidence network to integrate evidence-based healthcare within a theory-informed model that brings together academic entities with hospitals and health systems. The functions of the JBIC are very much directed towards the knowledge needs of local clinicians and consumers, with each JBIC entity leading evidence-based initiatives in their country, state, or specialty through the delivery of high-quality programs of evidence synthesis, transfer, and implementation to promote and support the use of the best available evidence to inform decision-making for health policy, systems, and clinical practice. As a global collaborative evidence network, the value of the JBIC comes from the skills, knowledge, and professional connections that we share with each other. We often refer to this as social capital, which is the resources received from knowing others, resources embedded within and available through or derived from the relationships within the network. Building networks like the JBIC that enhance the social capital of its members can bring together people who would not otherwise have the opportunity to interact. Benefits also include access to evidence-based practice information and resources, training, mentorship, and meetings and events like this one today, where colleagues can share ideas and build their collective wisdom in evidence-based healthcare. The JBI Collaboration operates within what we call an activity matrix framework that was co-designed with partners in 2015. JBIC entities contribute to more than 15 different activities informed by JBI's model of evidence-based healthcare. This framework has been established to formally acknowledge the important scientific, scholarly, and collaborative contributions of JBIC entities to our collective mission and to ensure that as a network we are sustainable and equitable across the world. Now, most of the activities within the JBIC matrix are geared towards either acquiring, developing, exchanging, disseminating, and/or using knowledge. Systematic reviews are central to facilitating evidence-based decision-making for policy and clinical practice, and JBIC entities conduct systematic and scoping reviews to address gaps in knowledge in their local settings. These help to answer policy and clinical questions that go beyond therapeutic interventions and look at patient and caregiver experiences to report on costs, diagnostic, prognostics, and more. JBIC entities also contribute to JBI's 11 unique methodological groups that provide ongoing guidance on the development, testing, and review of JBI's synthesis methodologies. A commonly quoted estimate, however, is that it takes an average of 17 years for just 14% of published evidence to be widely incorporated into clinical practice, with implementation uptake being uneven over that time frame. This is where JBI's implementation framework, training, courses, and audit and feedback software and resources are aimed at the integration of evidence into clinical practice. JBIC entities conduct evidence implementation projects following JBI's clinical audit and feedback approach and publish the results of those projects as implementation case reports in the JBI Evidence Implementation Journal, as well as in local language or discipline-specific journals. These case reports document the methods, processes, and changes that lead to practice improvement, improve patient safety, optimising clinical outcomes, increase patient satisfaction, and reduction of costs. JBI recognises that implementation is not an overly technological process, but rather it's a human process. And while health professionals are central to implementation activities, they often have not had formal opportunities for training in the processes for implementation. To this end, JBI and the JBIC co-created the Clinical Partnership Engagement Program, where the knowledge needs of healthcare community are paired with the skills of experienced academics to address translational gaps and promote an evidence-based approach to healthcare delivery. JBIC entities undertake wide-ranging evidence-informed activities to transfer the knowledge and skills to support their clinical partners adopt an evidence-based approach to policy and practice within their organisation, ultimately to improve the quality and safety of care. Engagement may be at a unit, clinic, or organisation-wide levels, and they include activities like journal clubs, grand rounds, establishing EBHC champions, evidence implementation training, and assisting their partner undertake evidence-based audit and feedback projects. The goals and objectives for each clinical partnership are varied and normally traverse the JBI model across synthesis, transfer, and implementation activities. As you can see from the few examples here, the partnership goals are bidirectional in that the goal is not only to engage with clinical stakeholders to identify knowledge needs, but also to build their capacity in research and evidence-based practice to ultimately improve the uptake of evidence into clinical practice. Similarly, the JBIC mentorship program provides a formal platform for experienced JBI Centres of Excellence to mentor novice JBI affiliated groups or prospective groups, or even groups that need assistance. Mentorship within the JBIC is an opportunity to collectively build support systems, create learning and development opportunities, and pass on corporate knowledge and leadership. Over our 27-year history, JBI has witnessed mentorship produce many positive outcomes for both mentors and mentees. And in fact, most centres and groups involved in the program have referred to their mentoring relationship as rewarding, reciprocal, and mutually beneficial to both parties, with the exchange of knowledge often going both ways. Since 2016, more than 20 new affiliated groups have joined the JBI Collaboration following formal mentorship by JBI Centres of Excellence. Knowledge dissemination and exchange are also achieved through the global delivery of JBI's evidence synthesis and implementation training programs, with over 1,500 participants trained by JBIC entities globally each year. JBI's Train the Trainer programs designed to enable JBIC staff to become accredited trainers and deliver JBI short courses to their local networks, which has been a really successful way for JBIC entities to promote and support evidence-based healthcare in their communities. Here you can see a snapshot of the achievements from the JBIC European region over the last 12 months for some of the activities that I've outlined today. Now, this brief overview, however, doesn't even begin to scratch the surface of the number of activities or initiatives that have been driven by the JBI European region over the last 27 years. There have been projects working with governments and policymakers at the state, national, and regional levels, and with international bodies like the World Health Organization to address policy and practice change, as well as regional projects aimed at bringing health professionals together to reduce translational gaps in evidence-based healthcare, and conferences and events that have brought together thought leaders from across the region, just like today's symposium. At a high level, JBIC entities play a vital role within the global evidence ecosystem to advance knowledge that is the science of evidence synthesis, transfer and implementation, to build capacity for researchers, students, clinicians, decision makers in evidence-based healthcare. They inform decision-making and contribute to policy and practice change that has a real impact on healthcare, health systems and health outcomes, much of which is achieved through strong and equitable partnerships at the local, national and regional levels. Now, every JBIC entity has a story of change where their activity, project or intervention informed by the JBI model of evidence-based healthcare has contributed to changes in health policy, guidelines, clinical practice or health outcomes in their local setting. You can learn more about these stories of change by reading more than 30 impact stories available on the JBI website. These impact stories provide a rich insight into how different individuals and organisations have adopted JBI's approach to evidence-based healthcare, what has changed and how, the positive, contextual and challenging experiences and outcomes, and the lessons they have learned from their work in evidence-based healthcare. Now, before I finish, I would like to highlight that while we talk about JBI centres and groups and activities and initiatives within the JBI collaboration, fundamentally, what is at the heart and success of our global collaborative evidence network is partnerships and relationships between people. Within the JBIC, the people that you see pictured here and thousands of others work together with mutual respect and a shared vision to improve lives through evidence-based healthcare. They have a focus on equity to ensure that everyone, irrespective of geographical location, which language they speak or specialties they focus on, have the opportunity to learn from each other so that meaningful and sustained outcomes can be achieved. To conclude, I would like to bring it back to JBI's approach to evidence-based healthcare. JBI recognises that healthcare is complex, that there is no single linear approach that will work every time to move research evidence into policy and practice. Evidence will not always be feasible or appropriate or meaningful or even effective in a given context. We recognise that local knowledge and the collaboration of researchers, healthcare professionals and decision makers on the ground through the JBIC are critical. We therefore encourage and stand by the need for sharing and localising knowledge and supporting and engaging with our colleagues in the JBI collaboration to take steps together, however small, to make a world of difference to health outcomes globally. I hope you have found this presentation useful. If you are not already connected with JBI, we encourage you to do so. Thank you again to our European colleagues, and I wish you all the best for a successful symposium. Thank you.